The title of my thesis is the Peak Relational Training System for Adults with Autism and Developmental Disabilities, Correlations with the Vineland and VB-MAP Assessments. Introduction. The prevalence of any developmental disability has increased from 12.84% to 15.04%. In particular, autism spectrum disorders is estimated to affect 1 in every 68 children, 1 in 42 boys, and 1 in 189 girls. The number of children diagnosed with autism or developmental disability who will become an adult or adolescent over the next few years is considerable. We need more intensive evaluations and services to address this aging population. Applied behavior analysis is an empirically supported way to treat autism symptoms non-medicinally. ABA is defined as the science in which tactics derived from the principles of behavior are applied systematically to improve socially significant behavior, and experimentation is used to identify the variables responsible for behavior change. Verbal behavior. Verbal behavior is a major component to the improvement of socially significant behavior. Skinner defined verbal behavior in his 1957 publication as behavior that is reinforced through the mediation of another person's behavior. ABA programs have been developed to assess and promote the important aspects of verbal behavior. Verbal behavior therapy is an ABA approach to the acquisition of language skills. Again, Skinner defined this in his 1957 publication of verbal behavior as a unit of analysis consisting of functional relationships between behavior, motivative, and discriminative variables and consequences. Verbal operants, behavior that is distinct from a particular response form, and are components to a more advanced form of language. Verbal behavior therapy is rooted in the development of each verbal operant. It focuses on the independent training of the speaker and listener repertoires. Skinner defined the speaker as the individual who emits the verbal behavior and the listener as the one who implements the consequences for the speaker's behavior. Various populations and language skills. There's been an increase in the number of published articles over the past decade. Valid and reliable assessments of language from a behavior analytic perspective are still needed. The standardized assessments used in this study are the Verbal Behavior Milestones and Placement Programs, or VB-MAP. The VB-MAP contains 170 skills that are divided across 3 developmental levels. Skills assessed by the VB-MAP range from basic language skills to more advanced forms of language. The Vineland Adaptive Behavior Scale is used to identify communication, daily living skills, socialization, and motor skills. Each domain used in this study consists of subdomains which target behaviors and skills important to adaptive functionings. Scores from this assessment provide a measure of an individual's daily function in adaptive behavior. Promoting the emergence of advanced knowledge and relational training system, also known as PEAK, is another module used in this study. PEAK contains 4 modules overall that provide a comprehensive evaluation of an individual's verbal repertoire and includes all the concepts in Skinner's 1957 account for verbal behavior. The purpose of the study is to demonstrate that the PEAK relational training system is an effective tool for the development of language and cognition in adults with autism. Specifically, this study will evaluate if generalized behavior change occurs following the implementation of the PEAK direct training assessment. 3 participants were used in this study, all males aged 19 to 22. All participants contain a diagnosis of autism, consisting of 4 rectangular tables and 12 chairs. The design for the study was a multiple probe design which consisted of 4 phases: baseline, treatment, generalization, and maintenance. The baseline phase consisted of the VB-MAP, Vineland-2, and peak assessments were evaluated. Participant 1 began the treatment condition while the other 2 participants remained in baseline. When baseline scores for the 3 assessments were completed for a second time, participant 2 then began the treatment. Participant 3 remained in the baseline phase until a third set of assessment scores were completed. Treatment consisted of programs from the Peak Direct Training Assessment, or Module 1, were implemented based on the participants' baseline peak scores. Programs from the Peak were implemented in a discrete trial training fashion. Each program included 10 trial blocks. A prompting procedure was used to score participants' performance on each program. The experimenter recorded data based on the number of prompts it took the participant to correctly record the skill. Sessions were conducted 5 days a week, Monday through Friday, and approximately took 45 to 60 minutes to complete. Each participant was trained by the same experimenter throughout the treatment phase. Programs were directly trained to participants until they mastered the program. When a program was mastered, the next program was introduced to participants in sequential order from the Peak Direct Training Assessment. The criterion for mastery of peak programs was considered to be a score of 90% or higher for 3 consecutive trial blocks. Generalization and maintenance. Intermittent measures, or probes, were conducted for the VB-MAP and Vineland assessments during the treatment phases. Generalization probes for the VB-MAP and Vineland-2 assessments were conducted. A maintenance probe for the Peak Direct Training Assessment was conducted 2 months following the treatment. Dependent measures and reliability. The dependent measures consisted of assessment scores on the VB-MAP and Vineland-2 assessments. An increase in scores were evaluated to participants' peak scores. Inter-observer reliability, IOR, was used to determine the accuracy of assessment implementation and the reliability of assessment scores. IOR measures were obtained by having a second observer implement each assessment a second time for 25% of the participants. IOR was calculated by dividing the lower assessment score by the higher assessment score and multiplying by 100. IOR ratings for the Peak Direct Training Assessment, VB-MAP, and Vineland-2 assessments were 85%, 87%, and 89% respectively. Results. This figure shows the multiple probe design. The top panel represents participant 1, the middle panel represents participant 2, and the third panel represents participant 3. VB-MAP scores can be shown by the red triangles, Vineland-2 scores are represented by blue squares, and the peak scores are represented by black circles. A progression of the black line represents peak programming. That the peak relational training system is an effective treatment package for the development of language skills in adults with autism. A positive relationship between the Peak Direct Training Assessment and the VB-MAP and Vineland-2 assessments. Results revealed that scores for participants on the VB-MAP and Vineland-2 assessments increased in conjunction with their scores on the Peak Direct Training Assessment. This suggests that verbal repertoires and adaptive functioning levels for participants increased as a result of mastering programs from the Peak Direct Training Assessment. Another purpose of the study was to determine if generalized behavior change occurred following the implementation of peak programs. Assessment scores for the VB-MAP and Vineland-2 assessments were evaluated before, during, and after the implementation of peak programs to assess the development of skills for each participant. The results revealed an increase in assessment scores during and following the direct training of peak programs. All 3 participants were able to acquire new language skills and further develop their verbal repertoires throughout the study. This acquisition of new skills led to the development of skills in other areas such as daily living skills, social skills, and motor skills. Implications. This study demonstrated that the peak relational training assessment was implemented with accuracy and the measures were obtained reliably. The data obtained from this study provide empirical support for an evidence-based behavior assessment and training curriculum for verbal and cognitive skills for adults with developmental disabilities. Future research should continue to test the reliability of the peak relational training system, especially on the 3 modules that were not included in the study. Limitations and future research. The first limitation was the small sample size that was used in the study, which limits the external application of the results to the larger population of adults with autism. Our age range and disability level was minimal, containing only 3 young adults aged 19 to 22, all diagnosed with autism. A more comprehensive understanding of the applicability of these measures needs to be addressed by future research. Second, only 1 module from the peak relational training system was used in the evaluation with the VB-MAP and Vineland-2 assessments. An inclusion of all 4 peak modules may demonstrate the utility of the peak relational training system as a more advanced assessment of language development.